I'm Kelly Phillips Henry. I've been in the community mental health system about 15 years across 3 mental health centers in the state of Colorado. I certainly was not prepared to do this as testimony. I just thought we would be talking, so I apologize if all these thoughts don't come together. But I've had an interesting observation as I've now spent more time in the community mental health system than I have in the Department of Defense. My background is I'm a clinical psychologist who served in the active duty Air Force for over 12 years. And I'm watching very different systems in terms of how we functioned and delivered care in a military system versus what I'm seeing, pros and cons, of how we deliver care in a statewide system here in Colorado. When we serve in uniform, we have one vision, one mission. We aren't competing against each other. Family advocacy is not competing against substance use services, is not competing against mental health, competing against primary care. We are working as one team that wraps around the care of an individual and/or a family. I believe that is the vision of what these task forces are hoping to do. Much to your comment, it is about pure collaboration. And I believe in that Colorado, we can get there. I think what we need to think about, which I see as a unique difference between my experience in the Department of Defense and what I'm seeing as I work in a statewide system, is we had one funding source. When you have one funding source, you're not competing for those dollars to do the right thing. And what I see happening, much to what's been commented here today, is we are creatively trying to braid resources, to stretch those dollars, to work across the different agencies that we all need to connect to better serve a child, a family, an individual, or an aging adult. Sometimes I'm not sure as we put these things in place, we're mindful about how we set up the funding will drive how either we collaborate or we compete. I had to step out of your session early this morning, which I did not want to do because I needed to get on the phone with my federally qualified health center partner, where we have over a 10+ year relationship of how we serve refugee communities together, immigrant communities together, and our safety net communities together. And we are holding our partnership together on a shoestring, largely because of understanding we needed to grow how we provided behavioral health care in integrated settings. What maybe we didn't think through is what might that tear apart. And so, unfortunately, there have been different incentives by federally qualified health centers to think about how do they provide behavioral health care, again, largely for the right reasons. And the CEO of Stride and I talk about that frequently. Unfortunately, it's created different perverse incentives of how does each of us get paid to do that, which I know I don't just speak for myself. I speak for partnerships across the state between community mental health and federally qualified health centers that are undoing right now or are undone. And I believe that's a weakness of how we each bring our specialties together to collectively best serve a population. And I don't believe that was the intention of the state. Unfortunately, we need to go higher up that thinking process to how do we create a payment system that enhances collaboration, does not necessarily just drive competition. As practitioners, I believe collaboration is important. I think we are trying to work with our federally qualified health centers. And I don't believe in some ways we're having the best outcomes with the payment system that's been in place. And so I would ask that as we think through the mechanisms of how we improve our system, we have to understand that payment methodology will directly relate to either how we collaborate or compete. And I believe all of us in this room have the intention and the best hopes to collaborate for the people that we serve in our communities. Thank you.